Hello, everyone. My name is Cassandra Trimno. I'm with Sickle Cell 101. I have two very special guests here with me. I have Ms. Kimberlin George, who is the very first person to ever get cured from sickle cell disease back in the 80s. And that was through bone marrow transplant. And I have Ms. Teonna Woolford, who, as many of you may know, her story, she went on the road to get cured for sickle cell disease, and we'll get a little bit more into that. I'll let them tell their stories. So we'll go ahead and get started, and we'll start with you, Ms. George, if you don't mind telling us a little bit about yourself.
Well, as introduced, I'm Kimberlin Wilson George. I'm 46 years old from Baton Rouge, Louisiana, and I currently live in Houston, Texas. And here in Houston, Texas, I am a middle school registrar. And I was kind of scared to go back to work because of the COVID pandemic, but I'm okay now.
Absolutely. So I am Teonna Woolford. I'm 29 years old. I was born with sickle cell SS. I live in Baltimore, Maryland. I am a sickle cell advocate full time, and that is all I do. My life is about advocacy and educating about sickle cell. So I'm also a psychology student, and part of what motivated me to do that is just I feel like in the sickle cell community, they're working on gene therapy, they're perfecting the bone marrow transplant. There are 40 therapies down the pipeline, and we have 3 new FDA-approved drugs. So I feel like our physical needs are being met, but not our mental. So that's what inspired me to major in psychology.
So, like I said before, both of you guys have really inspirational stories that I think need to be shared on a broader basis. And what's, I guess, the similarity that we can draw from both of your stories was that you both underwent bone marrow transplant, 2 different outcomes, but I'd love to learn a little bit more about how just this life-changing event for you. How did it change your life? And I'll go ahead and start with you, Teonna.
Yeah. So growing up, I really didn't have a lot of complications with sickle cell. Like I would have maybe acute chest here and there, splenic sequestration when I was a baby, but it really wasn't until I hit puberty that things kind of started spiraling out of control. And by the time I was 15, I had both of my hips replaced, and was diagnosed with avascular necrosis in all of my joints, and I was just having a lot of infections and crisis, and I really just felt like my second home was in the hospital. And I had all these dreams and ambitions, but it was so hard to accomplish that because my body was like constantly failing me. And by the time I got out of high school, my dream of going away to college and like saying goodbye to my family and never looking back, that just wasn't attainable at the time. And so I was, one of my hematologists came to me and he said, "You just have horrendous sickle cell disease, and I'm running out of options for you. And I really feel like we need to get you a bone marrow transplant." So ideally, I would have had a perfect match and da-da-da. But like so many of us, I did not have a perfect match. And that's a whole other conversation about how we need more African American donors on the registry. But so then my mother, who's in nursing and was teaching at the time, one of her students came to her and asked her, did she know about a clinical trial at Hopkins and NIH where they were doing half-match bone marrow transplants. So long story short, my mother was my donor. I went through chemo, radiation, and all of that. And about 2 or 3 months in, I got incredibly sick, spiked a really high fever. All my blood counts just plummeted. And we found out that my bone marrow had shut down, so I wasn't producing anything, platelets or anything. So I was in the hospital for 4 to 5 months, and it was a really vulnerable time. I was at risk for hemorrhaging and all kinds of infections. So it was a tough time, but that was 10 years ago. And fast forward to today, I am so blessed because it's like on the other side of all that pain, it just pushed me into purpose to be the advocate that I am today. The guidelines with the American Society of Hematology on sickle cell disease and transplant will be released later this year, and I had the pleasure of contributing to that and giving the patient perspective and publishing on that. And I just got added to 2 working groups with the NIH Sickle Cell Cure Initiative for clinical trial design and outcomes for the gene therapy protocol. So that's really how it changed my life. It jump-started my advocacy work.
Yes. Okay. Well, my story started off at the age of 2. I was diagnosed with sickle cell, and I had crises on a weekly basis, just terrible crises. I was in the hospital on a monthly basis. I just remember crying all the time and just being in so much pain. And I could never keep up with my siblings or my peers. And I just always remember dreaming of living a normal life, a life with no pain, growing up, getting married, having children of my own. And going through those crises, those continued. And I became real sick at the age of 8 and was hospitalized. And at that time, I think I had pneumonia. I was having a sickle cell crisis, but then something else was going on with it. I was in Baton Rouge where I was living, at the time, and the doctors there couldn't figure out what it was. So my mom and I were flown to Memphis, Tennessee to St. Luke's Children's Research Hospital. And once I was there, they started tests immediately. And they found out that I also had AML leukemia. So I was now living with 2 blood diseases. And they came back and told my parents that they were going to give me 3 months to live at that time. And, that wasn't good news. Of course, me being 8 years old, I didn't understand all of that. But the doctors came to my parents and asked about doing a bone marrow transplant. And it was really going to be experimental at the time. And the transplant was done for the leukemia because, of course, there's no cure for the sickle cell. So my parents prayed about it and decided to go ahead and do the transplant. And I had my younger brother and I think my younger sister that were tested I think all my siblings were tested to see if they were a match, but those 2, they were a match, and they decided to pick my younger donor. So going through all of that, and while in the hospital at St. Jude, it was scary because they would try to keep it from me, but I would hear the stories of, Johnny or Sue down the hall just passed away, and, I would just be so scared, and I would be like, oh, am I going to be next? It was just a bad feeling. But had the bone marrow transplant 1983. The results came back, and it was the sickle cell and the AML were both cured. So that was a blessing from God, and I just say God had his hands on me. And also, with the researchers and everybody that, did the transplant. And like you said, Cass, first person in the world to be cured of sickle cell, which I am very, very thankful for that. And after the transplant, I stayed in the hospital for about a year, to recover. I ended up going back to school in 9th grade. And although there were long-term and short-term side effects, you know, the one devastating, like you said, Teonna, it was infertility. And they told my mom and dad, you know, some of the side effects that I would have, but that one right there was that was a heavy hit, because I always wanted to have, you know, kids of my own. But went back to school in ninth grade, graduated high school on time, went to college, got my bachelor's degree in child development, and accomplished my goal of opening my own daycare center. And I had my daycare center opened for 11 years before I decided to move to Houston. And after the transplant, although I didn't have, you know, the crisis anymore, I was thankful that God had given me another chance at life. But I would always have a little bouts of depression, you know, of me, am I ever going to have my own kids or whatever. But, you know, prayed about it, kept going through it, being strong, because I can definitely tell you that sickle cell, going through that, it made me a fighter and made me want to be the strongest person that I could ever be. And, you know, I always encourage people, you might be going through it at that time. Yes, it's pain, it's hurt, but always have faith, you know, and just continue to believe that I'll be okay. I'm going to get through this. And so today, I live life to the fullest. You know, I just thank God every day that He gave me another chance. And I love encouraging people, and just always tell people to keep the faith, stay positive, and always stay strong. You know, and I found that I didn't know how much of a blessing that I've been to people until I've gone to conferences, and, you know, people would come up to me and tell me, thank you for sharing your story. And it just touched me. And that's one thing that I love about it, that I can touch someone else, you know, just by telling my story and giving them that positivity and that encouragement. So that is something that I love to talk about it. And I'm sorry, but I'm getting a little choked up.
No, I am crying. I've been crying since you started speaking.
I'm sorry, but I just love to tell people to always, you know, stay strong, because God always got you in His hands. You know, just stay strong, stay positive. We go through it. We go through it, because those sickle cell crises were horrible. But He has brought me a long way, and I'm just so glad that I'm able to be here and be in the presence of others, so that they can see, you know, what can happen. It can happen. Just stay strong and stay positive.
Absolutely. Both phenomenal stories. And Miss George, you've really paved the way. You paved the way. You're the reason that many people are cured from sickle cell disease, if you think about it. So thank you so much for that contribution. Teonna, I noticed that, you know, there was something Miss George said that might have resonated with you. Do you want to share, like, you know, what you're feeling?
Yeah, absolutely. So, oh my gosh. I just don't think you realize, and I know you just talked about it, like inspiring others, but there's a huge community of people with sickle cell that I can go to, but there's not been that many that I could look to who have been through the transplant. And like meeting you face to face is just a full circle moment, because when I was going through it and in those dark days, like, people really used your story to encourage me and to speak into me. And when you're in the thick of it, because it gets so dark, when you're in the thick of it, imagine that there's another side to it. But I can say here 10 years later that now I am mentoring girls and guys who are going through the transplant and inspiring them and letting them know that there is another side, and that pain and that depression it's temporary, and you really can live and thrive and come out of that dark place. And hearing you, like, I really remember I told you off camera, getting my infertility diagnosis, and one of the nurses from St. Jude taking me to, like, your picture, your name, and she does this and she has 3 kids. And so that's something that I'm dealing with now, is the infertility. And it's just, it's been so hard to kind of process, because I was like you, I've always wanted 6 kids. And but even from that has come something. I'm starting my own organization around reproductive health and sickle cell. So we'll need to talk so we can bring you on board. But I really do, like Kaz said, like, you've paved the way. So thank you for inspiring me. You didn't even know me, but I feel like I know you. So just thank you.
Stay encouraged, because like you say, it's a very dark moment when we're going through those times. And like I always dreamed of, I want to be married and I want to have my kids and I want to do this and want to do that. But then you think, this pain, am I ever going to do that? And I'm happily married, met the man of my dreams, been married for 16 years. And like I said before, I do have three kids. They're not biologically mine, but they are mine. 12, 17, and 19. And so I just thank God for it. So just stay encouraged. Stay encouraged.
It doesn't take it takes the strongest of us to go through, the procedures that you all went through. I know me, myself, as, someone living with sickle cell disease, I am scared even thinking about getting a bone marrow transplant or anything to that nature. Just hearing just everything that goes into it, it really takes a strong person to undergo something like that. So I just kind of want to tap into what your mentality was going into this event. And Miss George, I know you were younger, but it's still, you were a strong kid going into this and, just getting your diagnosis. And Teonna, you're a little bit older, but still, you had to think through all of this and say yes ultimately to go through this. So I'd love to learn more about how you guys came to that decision, or how your family came to that decision to move forward.
Yeah, and I would love to hear from Miss George too, because it's something that I never realized. I didn't realize that you were a child going through that. I was 19, and looking back, that seems so young to me, but I would love to hear how you could comprehend and process that as a child. And I know that it was a little bit different for you with the leukemia, because you didn't really have a choice, like you had to. But I want to hear too.
Well, like I said, for one, I have a strong family behind me, and there were so many of us. And I guess just them constantly encouraging me and just being there for me, it gave me more hope, because at the age, as young as I was, I was depressed, because I'm in the house having a sickle cell crisis while my brother and sister are outside riding their bike. And I'm, I don't get to go out there and ride my bike like they do. So it was the point of that. And being in school, in class, I would miss a lot of class because I had the sickle cell crisis and I ended up in the hospital. But I guess just the faith and the strength that my mom had, she was just always there praying and just always just encouraging. And so I think that's what kept me going and made me such the strong person that I am today, because I mean, no matter what it is, I'm a fighter because, I mean, people would tell me I'll be like, I've had a hip replacement, you know, from the transplant or any other issue that I may have, you know, they'll be like, well, Kim, aren't you in pain or aren't you this? And I'm like, no, I just keep on going, you know, just keep on fighting, just keep on going. I take it because going through that really made me a tough, strong person. It really did. And I mean, that's the only thing that I can think of that I've gotten to this point. And so from then on, especially after the transplant and getting the results from it, I was like, oh, I have life again. So I can do this. I can do that. I'm going to do this. I'm going to do that. And from then on, it's just been pushing forward and keep going.
Yeah, you know what? I'm curious to know, and I will answer the question about the process and how I came to the decision, but I'm curious to know from you, being so young, and I know, and that resonates with me, like coming from a strong family of faith too. So did it ever occur to you that the transplant may or may not work? Did you think about that?
To be honest with you, no. I really didn't. I really didn't and like I say, it was a lot of my parents, you know, but when they came and said what they were gonna do, I was just like, oh, okay. I'm gonna be cured. I'll be able to do things now. So it never really set in that way that it wouldn't work.
Right. And see, that's interesting because for me either. And I was 19, but it never occurred to me that thing would not work. And a part of it, and this speaks to how we made the process. And like you said, I was in a depressed state of mind when I made that decision too. Like I was convinced that I could not live the quality of life I wanted to live if I still had sickle cell disease. So I'm in this consult with this doctor, and he's looking over my history and reading my complications out loud and literally says to me, if you keep going this way, I'm concerned that you're going to die. And we need to nip this in the bud right now. And then he just went on to paint this sunny picture of like, just get this transplant, your whole life is going to change, and kind of glossed over the risk, but make sure you get this transplant and your whole life is going to change. And then we go to like, you know, you've already had this happen. And then that very day during my consult, I found out about this silent stroke that I didn't know about. So really, by the time I left the room, I was like, Dag, I don't know if I have another choice. But I looked at him and I said, my only concern is that I don't want to be infertile. And he said to me, I don't know why you're so concerned with the transplant making you infertile, because with all these sickle cell complications, you're probably already infertile. And just kind of, so you know, I'm already sitting there depressed.
Yeah.
And then I hear that. And so really when I left the room, I felt like I didn't have another choice. So I mean, that's what we did. We went, we prayed. And when I got admitted to the hospital, I had scriptures all over my wall. I had my favorite sermon titles everywhere. And we stayed prayed up and stayed encouraged. And my faith is a strong part. So when it didn't work, I started really questioning my faith and my relationship with God. And as I got older, I just learned so much about the sovereignty of God, and his will be done in the end, and everything, I believe everything happens in his time, and we all have a purpose and a plan. And I'm seeing that now, that like literally everything I went through was necessary to get me to where I am today.
I guess as a follow-up question to that, how do you, knowing that things didn't work out the way you wanted it to necessarily, how do you stay strong and all of that? And how do you kind of answer that why me question and kind of make it all right?
Yeah. Well, that's the thing. Like, it's kind of been answered for me. I see why. Like, without that experience, a lot of the seats that I've had at certain tables I wouldn't have had. And as we've talked privately about what I'm getting ready to do with my organization, none of that would have happened without that experience. I wouldn't be the advocate I am. I wouldn't, and going through that, I was treated on a pediatric oncology floor, and just the VIP treatment that we got in comparison to how we get treated as sickle cell patients. So it's just, I'm saying, so much came out of that. I've got such valuable perspective, and it's so timely because curative therapies is a big thing in sickle cell. So it took me 10 years to get my why me answer. I see it now, but I didn't answer it for myself. It just started revealing itself with certain positions and voices that I've been able, and like Miss George was saying, there are 3 families I'm in touch with right now going through the process, and really just being able to speak to them and encourage them is so rewarding. And when you're in it, 10 years ago, if you would have told me I'd be encouraging somebody going through this, I would not have believed you. But that's the why me. Like, it was bigger than me. And I didn't know that at the time, but I see that now.
What about you, Miss George? How do you reason with the experience that you've gone through and make sense of it, so to speak?
I just say that everything happened the way it should have happened, because I can say that at one point I did question God, but then I had to back up from that and look and see the bigger picture that has come in the end. So it was just like Teonna, it just prepared me then for what's happening now. I may not have understood it then, but now I see why. And I'm here for a reason, and the reason I've seen is so that I can be like the encouragement for others. I can be an example of, this is what happened, this is what she went through, this is what can happen, this is what did happen, and this is what it is today.
We get kind of the spiel on, just this curative option, but there are things that you all have been through, or you both have been through, that isn't on paper or isn't in brochure, or just something a doctor could never tell you, that it's something you just have to experience for yourself. So what are some things that most people don't consider, but that you find important and that should be mentioned?
That's a really good question. A couple things. They do a good job. Well, in my case, they didn't do a good job, but in most cases, with that informed consent process, they do a good job making the patient and the family aware of the complications and the risk and all of that and the side effects, blah, blah, blah. But what they don't prepare you for, because they don't know, they haven't been through it, is the mental, like psychologically, that thing was crazy. And Kaz, that they've been trying to get me to consider doing it a second time. And my thing is, if I really had to, I could do the chemo, the radiation, all that again. But mentally, I don't think I can take it. And that's even if it was successful. Like, before I even found out I rejected, just the grueling process, I remember, like, my grandmother asking me, like, I'm here all day with you, you're not speaking to me, am I getting on your nerves? And I'm like, no, it's not you, I just don't feel like myself. Like, this is territory that I've never been in before, and the uncertainty is just scary. So they don't prepare you for the psychological effects that it will have on you and your family. And then something else that I wasn't prepared for. Ultimately, my bone marrow had shut down for 4 months, and I had a virus that kept reactivating, and that's what made me so sick and caused me to reject the transplant. So it took my platelets like 5 years to come back to normal. And one thing that I know people don't know, and something that I was never told, I have had 3 cancer scares now. I still have these periods where, like, randomly out of the blue, my counts will just plummet. And I'm in the same place I was 10 years ago, where I'm at risk for all types of infections and hemorrhaging. And every time that happens to me, I have to go through bone marrow aspirations. And, you know, they tell me, well, you had chemo, so you are at risk for leukemia, cancer, and I have to get all those results. I just went through that 3 weeks ago, where they really thought that I had a rare type of leukemia, and thank God I'm cancer free. So that's something that's not on paper.
I can agree with her on that, the psychological part. And they do prepare you, well, they, tell you there's going to be long-term side effects. But in my case, my long-term side effects are starting to happen, like now. When I got the transplant, sickle cell cured, the leukemia's cured, the immediate side effect I had to have a hip replacement. And I was okay with that. But now, everything's setting in. So there's been bouts of me having suspected other cancers as well. But thank God it wasn't what it was. But now, and which I didn't understand in the beginning, with the way my body was working, but going back and forth to St. Jude as they explained everything to me, everything in my body was radiated. And I didn't get that effect until, I would say, probably like maybe 2 years ago. I really didn't know like what was happening. I just knew I would have long-term effects, but there was nodules found on my thyroid, and they thought one was cancerous. They removed my thyroid, and it wasn't, thank God. And it's the high blood pressure, and it's type 2 diabetes, all those things that are coming afterwards. And it's not that they didn't tell me it'll be side effects, but I didn't think that it would be, that effective. Everything just hitting in the end. But still, I take it and with pride and keep going. And another thing I can say too, like once back at home and seeing doctors, and as I've gotten older, a problem that I've had is finding a doctor that would actually see me. They think I'm normal when I go in to see them or whatever, but then once I tell them my story and what I've had and what I've been through, I've had several doctors tell me, I think you're going to have to find another doctor. And that to me was kind of shocking, but I'm used to it now, so that's something. It's that that's not prepared for, but that's just something that I've gone through, throughout this process.
You know what? I'm curious to know. One thing, kind of how all this advocacy and these opportunities came to me. I went to a conference and they had a panel on bone marrow transplant, and everybody up there was a success story. And I was like, well, how come y'all don't tell the other side of it? It doesn't always work. Not to be negative, but people need to be informed. Like I've become a broken record, I'm sure, over the last 3 years, saying that. And what comes with that is families considering transplant or going through transplant who want my perspective, who want my advice. And every time that I do that, I get invested in that person's journey. And it's been mostly rewarding because most of the families I've been through it with, they go on to do well. But I'll never forget losing one of my friends to the bone marrow transplant. And I just think about sometimes the weight that comes with having gone through this process. And I'm curious to know what that's like for you to be the first ever cured, because I know for me there's a lot of pressure sometimes. So how is that for you?
For me, just to be honest about it, it's I hear it and I hear it all the time, but it's still like, I mean, I know I'm that person, but it's like, okay, I'm just normal, and
you're just you.
Yeah, I'm just me. So when people, come to me and they tell me and they be in awe and everything, I'm just like, yeah. And not that I'm not excited about it. I don't know how to explain it. Not that I'm not excited about it, because I am, but it's hit me, but it's still like unreal,
Yeah. I mean, because like you're not on the outside with all of us. Like you're just you, and you lived it and you went through it, and you're just you. But like to all of us, you're the first.
Yeah. Exactly. Yes.
You all have touched a little bit about this, but what advice would you have for others who are considering? We get a lot of people with an interest to undergo bone marrow transplant, and I know just from the very first bone marrow transplant, with you, Miss George, up until now, a lot has changed. Just in terms of chemo and, just the different types. So what advice would you have for other families considering going that route?
I think that I would go the same route that my mom went, because although seeing the dark side of it, there's still positive. And in the end, just having that mindset, it may work, it may not, but just being prepared for either or. Just being prepared for either or.
Yeah.
But it's something that because I have thought about that, what if I had a child that had sickle cell? How would I deal with it, knowing what I went through? How would I deal with it? Would I, would that be an option for me? Would I want to take it, or would I say no? But going through what I went through, I would do the same. I would do the same.
Girl, I have a list of what I tell families, and I had to make sure that when I started kind of giving this perspective, I had to make sure that I was healed from my own pain so that I don't project anything onto them. And so just being responsible with what I say. So I always start off with this disclaimer that you know, my thing was 10 years ago. The protocols have been amended. And just because I had a horrific story doesn't mean that has to be yours. However, I want you to hear my story because I want you to be informed. And my biggest piece of advice is, because I see people taking this question to Facebook. Like, I'm considering a bone marrow transplant. What should I do? Don't take it to Facebook. Because unless you've been through it, that's not something that anyone should really be talking to you about. And even for Miss George and I, we cannot tell somebody, we can't make that decision for somebody.
Right.
But what I need them to do is to really examine how much that cure means to you.
Mm-hmm.
And if you are aware that you may get sickle cell and traded off for another illness, this may happen. If you are aware of the risk and you are still willing to do it because you really want to try to be cured, then go for it. But make sure you are informed, do your research. I also say if you can get more than one consult. And the reason that I say that is because I was in one place and told I would die if I didn't do it. And then I went to another place a year later and they were like, girl, we wouldn't have even enrolled you in our protocol because the problems that you were having, we could have managed in another way without doing something as invasive as a transplant. So be informed, decide how much a cure means to you. Take some time, like don't rush. I made my decision quickly. And another thing, a big thing for me is to seek counseling because like we've both talked about being depressed. And I honestly don't think that this is a decision that you should make in a depressed state because they told me like this could happen, you could reject. But I'm so depressed and hating my life with sickle cell, I didn't even process that. All I'm thinking about is this cure. So I think it's important and not just counsel for you, but for your family as well.
Right.
Yeah. And you know, like have some outlets, journal, do all of that stuff. Those are my big and talk to somebody who's been through it. Like I'm always available.
Yes.
Absolutely. I guess my last question, what words do you both live by? Like what words really just keep you going and keep you uplifted that you can share with the sickle cell community that you think might resonate with them?
My words that I go by on a daily basis, walk by faith and not by sight. And because what I went through today, what I went through throughout my life, now I just call myself, a walking mirror. And so I just tell, I like I said, I always encourage people, but that's my thing. I walk by faith and not by sight.
Yeah, I get that. And that's so powerful because a lot of times what it looks like is not really what it is.
Yeah.
And even like this week, I've been waiting to hear back. I applied for a grant so that I could get my eggs frozen, and I was supposed to get notified yesterday. And when I didn't, I freaked out because it looked like it didn't go my way. It looked like I wasn't going to get it. And then when I was done freaking out, it just dawned on me to reach out to them. And they were like, yeah, we haven't even made the decision yet. So that's so powerful. But for me, my one word that I just that just keeps resonating with me is purpose. I just want everyone in the sickle cell community and beyond to know that and my favorite scripture is Jeremiah 29:11, that God has a purpose and a plan. But even for people who don't believe in God, I really do believe that we all have a purpose.
A purpose. Yes.
And that's the biggest thing that I take away from my story, because my transplant didn't even work. And I told you I had it because I didn't think I could live the life I wanted to live. But here I am with sickle cell, doing everything I've wanted to do and more. I'm back in school, and before COVID was traveling left and right. And so you can have sickle cell and thrive with this disease and walk in your purpose. And for that pain, when you come out on the other side, I believe that pain pushes you into purpose.
Yes, I agree with that. I so agree with that.